Okay. First thing I do is knock on the door. I walk up to my patient, introduce myself. My name is John. I'll be your nurse today. I'm going to perform hand hygiene and explain to the patient what I'm going to be doing. I'm going to be doing your postpartum assessment. So I'm going to put on wall gloves. What a postpartum assessment is, I'm going to check your body out, make sure it's healing properly after you had your baby. I need to make sure the patient is who they say they are, so I need two identifiers. So I get the patient's name, and then I get the patient's date of birth. Everything matches, so I'm good there. I need to get permission to do this from the patient, so the patient's giving me permission to assess her. Ask the patient how she's feeling. Make sure that you provide privacy, so I shut the curtain behind us. I'm going to ask the patient how she's feeling. She says she's feeling good. So we're going to go ahead and make sure that she has no known drug allergies. She doesn't, so we're good there. And now I'm going to proceed with the postpartum assessment. The first thing I'm going to do is check her breasts. I'm going to check for redness, swelling, hot spots, lumps, anything that would be a sign of infection. I'm also going to assess the patient's nipples. If they're clean, dry, and intact, everything looks good there. Need to find out if the patient's going to bottle feed or breastfeed. The patient's going to bottle feed, so she needs to wear a supportive bra. If the patient was going to breastfeed, or if the patient was going to bottle feed, she would need to wear a sports bra. Breastfeed, supportive bra, bottle feed, tight fit bra such as a sports bra. If I didn't say that, I need to clarify. I'm going to proceed to her fundus, massaging her fundus. I want to make sure that it is not deviated. If it is deviated, I need to have the patient buoyed and then reassess later. Everything feels good. It's midline to the umbilicus, so I'm going to proceed down to her C-section scar. Before I do that, I need to ask her if she's had any bowel movements, when her last bowel movement was. All right, she's regular, so we're good there. I need to check her C-section scar. I'm checking for signs of infection, Rita, redness, ecchymosis, edema, drainage, and I need to check approximation of the scar. It's good, so I'm going to cover her back up, and I'm going to proceed on down. I see no edema in the legs. She's good there. I palpated the bladder before I went to the legs. She was good there. Couldn't feel the bladder. No edema noted in the legs. I'm checking her popliteal pulses. She's good. Dorsalis pedis, posterior tibialis. Everything checks out good there. So I'm going to turn the patient over. I turn the patient over. I'm checking her epidural site. Again, I'm checking for signs of Rita, redness, ecchymosis, edema, drainage, and approximation. Everything looks good. I'm checking her lochia while I've got her turned over. She's got a scant amount. She had a C-section. She doesn't have much. While I've got her turned over, I'm also checking for hemorrhoids. Don't see anything there. She's good. I'm going to turn the patient back over, and something that I had forgot to do, I need to do, but before I do it, I need to wash my hands again because I was in her perineal area. I need to assess her bowel sounds. So I stethoscope on, I assess all four quadrants. She's active in all four quadrants, so that's good. Now I need to do some education for the patient. I need to talk to the patient about signs to look for if she's having any issues. These signs include extreme abdominal pain, severe abdominal pain, a temperature greater than 100.4, or she has any foul smelling lochia. It should smell like normal menstrual smell. Anything bad, she needs to come on in. Now that I've educated her about what to look for, I need to get her baby so I can educate her on some things about her baby. So make sure my hands are clean while gloves are on. get her baby, and I'm going to show her how to use a bulb syringe. To use a bulb syringe, you depress the plunger, put it in the baby's cheek pocket, pull out any secretions, put them on a paper towel, put the bulb syringe back in the other cheek pocket, pull them out, put them on the paper towel, into the nair, pull them out, onto the paper towel, and into the other nair. Pull anything out, put it on the paper towel. I've educated the patient how to use the bulb syringe, so I'm going to put baby back. And now I need to educate the patient on a few things about her baby. So I'm going to tell her about shaken baby syndrome, about a car seat, and about SIDS. So first thing I'm going to do is tell her about shaken baby syndrome. Your baby's going to cry. It's going to be annoying sometimes, but you need to just calm down, relax, set the baby in the crib. The baby's not going to be hurt by crying. Just walk away, give the baby a break, give you a break. That leads me into how to put your baby down for a nap. When you put the baby in the crib, you need to lay the baby on their back, dressed in something warm, but you don't want to put a lot of pillows, a lot of blankets, a lot of padding, anything like that. Baby's going to be fine. Just put the baby on their back with nothing around their face. And I'm also going to talk to you about a car seat. Now, if you have a new car seat, you're good. It needs to be a rear-facing car seat. If you have a used car seat, it needs to be within date. It does not need to be, and it doesn't need to be involved in an accident. Those things tear up, that plastic degrades, so we need to make sure that the patient has a new car seat or a car seat within date before they take the baby home. Now, once they take the baby home, they need to look for signs that the baby's having issues. If the baby refuses 2 consecutive feedings, if the baby has loose, green, runny stools, or if the baby has a temperature greater than 100.4, those are signs that the baby's having issues. You need to bring the baby on. So I've educated you and I've done your postpartum assessment. I'm going to take my white gloves off, perform hand hygiene again. The bed is locked and lowered. The call light is the call light's in place. And I want to thank Mrs. Mouse for her time and exit the room.